honestly, that's where my involvement with men in nursing kind of stemmed from, was getting that exposure and like having a goal to try to expose other folks to men working in nursing.
Yeah. So speaking of men in nursing, this group that you pretty much created, right?
Yeah, so I would say I revitalized the group.
Okay.
We have a long history of wanting to do things for men in nursing. I'm not sure if there was like an organization tied, but I know that the instructors were wanting to do stuff for men in nursing. Luther Chrisman, he's one of the first College of Nursing male dean, I think back in like 1972.
Okay.
So it was a lot of like trying to get more men into nursing. When I started my DNP program, I created a men in nursing group in alignment with the chapter of American Association for Men in Nursing. And I had another group, which you mentioned the video. There weren't many men in the program, but 2 out of 3 of the individuals opted to be a part of a mentorship with me.
Okay.
And so that group on that video, the two of them are in that video alongside other folks who have like come and joined us. And that's more of like, it's part of men in nursing, but it's like our affinity group. Because most of the people in the video are practicing nurses now. So we started in the college, and most of them were students, or they may have been somebody I hired when I worked as a unit director. So it's been cool to kind of see how much publicity that has gotten.
Yeah. And what's even like really cool to me, you talked about your experience with Dr. Brown.
Right.
And now you are the Dr. Brown for these guys.
Yes.
And you've watched them become nurses from students.
Right.
Like that's so cool.
I'm getting chills because honestly, it's something that you never think that you can create something or do something, but it's kind of one of those things where like somebody got to do it.
Right.
So it's cool watching them, they stress over their tests, and I'm like, look, that's normal. It's gonna be okay. And I was like, now y'all are practicing nurses. Remember y'all were students, and so I think it's cool for them to see themselves, and which is like see themselves in me, like I saw myself in Dr. Brown. And I think that has been one of my biggest like missions now. I'm like, I'm not a big social media buff type person, but I need to get out there. People need to be able to identify with me and see that, look, you can be a nurse too.
Yes. Yeah. Speaking of men in nursing and social media, we want to play your viral TikTok video.
Let's go.
So take a look.
Did you know that out of 4.2 million nurses in the US, Black nurses make up 6%, men 9.4%, and Black men are statistically unrepresented? By having more Black men in nursing, we can improve trust in healthcare for Black male patients. This can reduce their mortality gap compared to white male patients by 19%. We need more diversity in healthcare. Our nurses at Rush have answered their call.
What's up, everybody? If you want to see more videos like this, make sure you're subscribed to our channel and click that notification bell so you don't miss a thing.